Hi, ladies and gentlemen. This is Dr. Novoa. I was answering some questions on Facebook yesterday, and I was overwhelmed by the number of responses and questions to a specific topic, and that is for ladies that are considering or having hysterectomies. They're concerned about whether or not they should preserve or not remove the cervix because of concerns that it may affect their ability to have or to enjoy sex. And this is a really important topic to them, and I can understand why. And they're not getting a lot of information back from their doctors, or if the subject's not even being brought up. So the question is specifically, if you have a hysterectomy, is it okay to have a total hysterectomy, which removes both the cervix and the uterus, or is it better to have a subtotal hysterectomy, which removes only the uterus and leaves the cervix behind? Specifically associated with the fact that does it affect the enjoyment of intercourse? So that's a lot of information in one or two sentences, but let's go over a couple points. Number one, there haven't been a lot of studies on whether or not it does affect the overall enjoyment of intercourse, but there is the idea that if you are able to preserve the cervix and not remove it, that the all of the nerves that are associated with the cervix, because the cervix does have points of stimulation, are also preserved, and therefore orgasm is maintained and not affected by hysterectomy. So there is some concern about that, and understandably so. There was a question, well, if you remove the cervix, then you can't enjoy intercourse anymore, or could that affect having enjoying intercourse? And it's really traumatizing to some ladies that they're concerned that if they have to have a hysterectomy for a variety of reasons, is it affecting or would affect their ability to have intercourse or to enjoy intercourse? And so bottom line is we don't have a significant amount of information on that, but based on the overall data that we do have, it hasn't come up as a major issue for ladies that have had a total hysterectomy, that their sex lives changed that much. As a matter of fact, we happen to have an opposite response, that for those ladies that are having to have hysterectomies for a lot of reasons, that they are able to enjoy intercourse, or that their sex lives do improve. So there's other concerns with removing the cervix. Specifically, does removing the cervix increase your risk that the vagina will prolapse, or will over time will fall, or actually even come out of the overall of the vulva? And again, this is a concern. And the if you compare what the risks are related to that, if you remove the cervix, which is holding up the vagina for all intents and purposes, what is the risk that over time the vagina would fall? And there's approximately about a 3% chance that over a 10-year period of time that you would have a risk of what's called a vaginal prolapse. However, if you preserve the cervix, there's complications related to keeping the cervix. First of all, you do have the risks associated with cervical cancer or abnormal pap smears. But if you preserve or do not remove the cervix, there's approximately about a 17% chance that you may have irregular bleeding, because there's still going to be cells of the uterus attached to the cervix, and then some women still have tissue that is left behind that will cause irregular bleeding. And unlike a menstrual cycle that occurs once a month, irregular bleeding associated with leaving the cervix behind can be consistent or chronic, which will require additional surgery. So you have a risk of a 3% risk of the vagina falling or having a prolapse versus a 17% risk of irregular bleeding. Now that's on the subject of bleeding and vaginal prolapse. In terms of the subject of sexual response, let's address a couple points. Number one, for those ladies that enjoy having the most stimulation is from external stimulation for orgasm, then a hysterectomy doesn't have that much of an effect. But for those ladies that enjoy or can only have an orgasm from a vaginal approach or vaginal penetration, then you can have an effect on removing the cervix. And why is this? Well, not only do you disrupt the nerve impulses to the general area where the cervix used to be, but you disrupt a specific area which is controversial, but I have seen that it actually exists, an area called the A spot, or the AFE area. Now, this is an area just above the cervix and just in front of it, which is in the anterior fornix, which is the anatomical area. So if you disrupt or remove the cervix, sometimes you affect the A spot. And this is an erogenous zone, which produces a great deal of stimulation for some ladies, especially for women that are having intercourse with men that are above average size or above average girth. And so that might be an issue. But hysterectomy generally does not affect the G spot, which is another erogenous zone, which a lot of people know about. And the G spot is so far forward of where the cervix is that it generally is not affected by a patient having a hysterectomy. Also, there's other areas, other erogenous zones that are important. Specifically, of course, everyone that should be having intercourse and enjoying it understands what the clitoris is. That's the most sensitive area for women. But there's also another spot called the U spot, and the U spot is around the urethra, or where a woman urinates from, and it's on the sides and just above the urethra. So now we're talking about some major areas. We're talking about the clitoris, we're talking about the U spot, we're talking about the G spot, we're talking about the A spot. And of course, the most important one is the brain. I mean, obviously, if you're not into having intercourse, or there's reasons why you're not enjoying it mentally, it's going to affect you physically. But these are the major areas in the vulva and the vagina which are stimulated and lead to enjoyable orgasms. And so if a woman is having problems after a hysterectomy, first of all, she should not panic. She should give herself some time in order to recover from the surgery itself. And generally, the nerves are going to grow back within 6 weeks to a few months. But if she does notice that there has been a change, she should try to focus in on stimulating the A spot area. Of course, also the G spot, and then that's for the inside. So for the outside, you're talking about clitoral as well as U spot stimulation. Now, this, understandably, we now have the idea that the female orgasm is a very complex situation, and that's why men, which are more anatomical and easy to stimulate to orgasm, are much easier to understand as compared to the female orgasm, which is much more complex. So I kind of compare it to men being a bugle and women being more like a piano. Okay, so it's very complex to play the piano, and so men have to understand and have to learn from their partners, and women have to be able to express openly what they like and what they don't like, because it's not just mechanical for women. And so the take-home message related to this is that, yes, there can be some changes after a hysterectomy, whether or not the cervix is removed or not removed, but the key is to learn what you enjoy the most and then work from there. Men, you have to be open-minded about understanding that after a surgery, there's going to possibly be some necessity to relearn having sex or making love, and that you should be open-minded and try to understand that although things have changed, that it's not necessarily a complicated situation, that you might be able to go ahead and relearn all of this together, and that it can be much more meaningful and much more enjoyable. So for both partners, there's a new learning experience after a hysterectomy, but it doesn't take anything away from the fact that you can not only enjoy intercourse again, but actually it can become a lot better. This is basically a simple description of what may or may not happen after a hysterectomy, but in no way should a woman not consider having a hysterectomy if her doctor has recommended it for a medical reason. And whether or not you keep the cervix or don't keep the cervix, that's going to be a discussion between you and your doctor. And it is something that you should bring up to your doctor, especially since the majority of OBGYNs don't bring this up as a subject matter. But it is important to discuss. And I hope this helps you a little bit. There's a lot about the female sexual response that's extremely complicated. We could go into many, many subjects on this, but I just wanted to quickly respond to some of the questions that were asked yesterday. And I hope this has helped out a little bit to help women understand what's going on after hysterectomy, after keeping the cervix versus not keeping the cervix. And feel free to send me questions, and I'll try to answer them the best I can. Thank you very much.